Hi y'all, I'm Stephanie McBride, and I'm just going to go over a few ways to adapt essential oil use during pregnancy. So if you already know a lot about essential oils or a little bit about essential oils, you're already using them in your day-to-day life, and now you're pregnant, you might want to know what you should do differently. And I guess right off the bat, I would just say that women are more sensitive to things during pregnancy. So the oils that are sun sensitizing, like the citrus rind-derived oils, are going to be more sun sensitizing. That's because we have a hormone called the melanocytic hormone that's higher concentration during pregnancy. So be more careful with things like bergamot and lime and grapefruit and lemon. Orange, wild orange is like the least sun sensitizing, but just allow like 12 to 24 hours after applying to your chest, for example, and going out into the sun or cover up with something. Our skin's also more sensitive in the nature of like some oils are really strong, like peppermint, for example. So usually maybe you can put peppermint on your chest, no problem, but during pregnancy you might have a reaction. So I don't say don't use them neat or without a carrier, but I say start with a carrier, and if you don't have a reaction on your wrist or your foot within 12 hours, you can move on, or just watch out for that, especially if you're recommending these to other people during pregnancy. I also don't recommend essential oils taken orally during pregnancy unless you're working with a qualified practitioner, just because they are really strong. They're used as medicine to replace medicine. So we just don't have enough research for me to be really comfortable with those uses. However, if there are like formulated vitamins, things like that with oils in them, I would say those have been tested pretty well on pregnancy. I would feel safe about that, but I might start with a half dose and build up. Yeah, there's just a couple others that I would say use with moderation, like wintergreen and blends with wintergreen, just because that's where we get our, like birch and wintergreen are where we get our aspirin. It's methyl salicylate is the main constituent that helps so much with muscle aches and pains and circulation, but it's also the fact that like our blood is doubled in volume during pregnancy. So I would say, use that with caution during pregnancy, very moderately, and then it's great for labor pain, but just beware that it has that effect of thinning the blood. A couple others like cinnamon and clove, I say use in moderation, just because of the effects on the body. And then there's things like clary sage and jasmine and rose and myrrh. Those all have effects on contracting the uterus, which is just amazing during labor, especially if the labor is slow, contractions are irregular. But I would reserve those, especially clary sage, until after the mom is ready to go into labor. And I'm just going to conclude by saying, look at this beautiful castle I'm in, 800-year-old castle in Ireland, in County Sligo. And I'll report back to you guys soon with another video. Take care.